Everyone, so I am doing these videos on MLT subjects. So yeah, started with mycology. In that I have done with yeast like budding, and also the moulds. So in the moulds done with dermatophyte, aspergillus and zygomycetes, and with this we are going to complete moulds. Then we can go for dimorphic fungi. So moulds, yeah, we are going to see penicillium. So penicillium, we have two types, pathogenic and non-pathogenic fungi. So coming to the pathogenic fungi, it's an opportunistic pathogen in HIV infected persons. Example is Penicillium magnifique. So coming to the non-pathogenic fungi, these non-pathogenic fungi produces antibacterial antibiotics and antifungal antibiotics. So antifungal antibiotics producing fungi are low-later species of Penicillium, which produces penicillin, and Grisofulvum species which produces Grisofulvin antifungal antibiotic. So Penicillium magnifique, it's a saprophytic and it's a dimorphic fungi. This is the only dimorphic fungi of the genus Penicillium and is emerging as a pathogenic fungi, and it causes a fatal systemic mycosis. So dimorphic fungi, it is in two forms: yeast form at 37 degrees centigrade and mycelial form at 25 degrees centigrade. All yeast form produced by budding, but Penicillium magnifique, it multiplies by fission, by schizogony. So whatever the merozytes which are produced, that enters the red blood cells and causes infection. So can see the characteristic septum in the yeast form. So the mycelial form you can see here. You can see the conidia, phyllites, conidiophore and septate. So there is the absence of vesicle, whereas aspergillus is having vesicle, but this does not have vesicle. So mycelial form of Penicillium magnifique. So coming to the pathogenesis, Penicillium magnifique causes granulomatous changes and necrotizing changes, and these granulomatous changes occurs in normal persons, whereas necrotizing changes occurs in AIDS patients. So these changes can be seen in these organs: lungs, liver and skin. So clinical significance. Coming to the clinical significance, we can see the systemic penicillosis. So may cause low-grade fever, chills, malaise, weight loss, anemia, cough, lymphadenopathy, hepatosplenomegaly, diarrhea, fungemia, nodules, pustules, and necrotic pustules, postular and granulomatous postular lesions. So we said that granulomatous changes and necrotizing changes occurs in liver, lungs and skin. So those changes can cause this. So Penicillium magnifique can be outcome of primary infection, reinfection and reactivation of latent infection. So all the signs and symptoms are same in HIV positive and negative persons, but in AIDS patients, Penicillium magnifique presents as arthritis, osteomyelitis, pericarditis, pericardial effusion and peritonitis. Penicillium magnifique lab diagnosis. So specimen we take is body fluids, biopsy, bone marrow aspiration and lymph nodes. So direct microscopy, when we do hematoxylin and eosin, PAS and GMS staining, we can see the characteristic transverse septum of the yeast form of Penicillium magnifique. So yeah, coming to the culture, when we do inoculate on Sebrods dextrose agar at 25 degrees centigrade, we can see the greyish white, yellowish green, grey or green colonies, and after 2 weeks we can see the wrinkled colonies. So reverse of the medium, we can see bright red to brick red as red pigment diffuses into. So other tests we do is X-ray, cavity formation, for a cavity formation and diffuse infiltration, and PCR and Western blot for antibodies detection, and CT scan and MRT is done to see the to detect the depth of the lesions. So coming to the treatment, amphotericin B and precautions, biosafety levels too can be taken. So with this we have done. So this Penicillium magnifique can be asked as short or long note. This is a frequently asked question. So done with Penicillium magnifique, and we are done with the Moulds with this topic. Then we will go for the dimorphic fungi, and yeah, do well in your examination. All the best. Thank you.